So in this lecture, we are going to discuss a new topic, which is blood dyscrasia, dental management of patient with blood dyscrasia. Dyscrasia means disorders of red blood cells or white blood cells, or what we call leukocytes. These disorders could be decreased or increased in the number of the red blood cells, or decreased or increased in the number of the leukocyte or white blood cells. In this lecture, we are going to focus on the disorders of red blood cells. So there is either increase in the number of the red blood cells as in case of polycythemia. And polycythemia actually occurs due to certain circumstances, such as in case of high altitude. The decrease in the number of the RBC is called anemia. And usually anemia occurs for certain reasons, such as in case in the decrease of the production of the RBC, or due to blood loss, or due to destruction of the circulating RBC. So there are three reasons for the decrease in the number of the RBC. Anemia by definition means there is decrease in the oxygen current capacity of the blood due to the number of the RBC. And as I mentioned before, that the decrease in the number of the RBC could be due to decrease in the production of the RBC due to decrease in the vitamins, such as, or deficiency in certain vitamins, such as vitamin B12 or folic acid, or due to iron deficiency, or due to certain factors could be or could lead to decrease in the production of the RBC, or could be due to blood loss due to hemorrhage or bleeding, or due to destruction of the circulating RBC. This is actually the destruction of the RBC or circulating RBC could be related to extracarboxylar or intracarboxylar reason. Intracarboxylar, that means within the red blood cells, as in case of, for example, hemoglobinopathies, abnormal hemoglobin, as in case of sickle cell anemia, or in case of accumulation of the byproduct, metabolic byproduct. So this will lead to damage of the cell membrane and subsequently destruction of the RBC. So this is destruction. So this is all these causes: blood loss, destruction of the circulating RBC, or decreased production of the RBC. All of these, this will lead to anemia. In general, anemia can be, actually there are many classifications for the anemia, but could be, in general, there are four types of anemia: iron deficiency anemia, pernicious anemia, glucose 6-phosphate deficiency anemia, and sickle cell anemia. Actually, this is in order to discuss certain types of anemia. So, for example, in case of iron deficiency anemia, this is usually occurs in case of female, in case of menstruation. So, in case of menstruation, patient or female patient usually complain of iron deficiency anemia. In male also occurs. So, in case of, for example, malignancy, or in case of ulceration or GIT ulceration, also this may lead to what we call iron deficiency anemia. Pernicious anemia, this is actually due to deficiency in the vitamin B12 or folic acid. As I mentioned before, both of these, vitamin B12 and folic acid, responsible or important for the synthesis or production of the RBC. So due to deficiency or lack of intrinsic factors, this will lead to deficiency in vitamin B12 or also folic acid, and this will lead to pernicious anemia. In case of glucose 6-phosphate deficiency anemia, this is destruction hemolytic anemia. This type of hemolytic anemia because the RBC will be destructed due to accumulation of the metabolic pathways within the RBC, and this will lead to damage to the cell membrane and destruction of the RBC. Sickle cell anemia, also this type of hemolytic anemia in which there is what we call hemoglobinopathies. That means there is abnormal hemoglobin. So instead of hemoglobin A, there is hemoglobin S. And hemoglobin S tends to crystallize under certain circumstances, such as in case of decrease in the pH, as in case of acidosis, in case of infection or aspirin, or the S hemoglobin could be crystallized in case of dehydration or in case of lower oxygen tension. So lower oxygen tension, decreased pH, And also in case of dehydration, this will lead to crystallization of the hemoglobin S, and this will lead to damage to the cell membrane and destruction of the RBC. Actually, in case of destruction of the circulating RBC, this will lead to what we call erythrostasis. And also there is an increase in the viscosity of blood and decrease in the blood flow, and subsequently this will lead to occlusion of the blood vessel, and this will lead to thrombosis and subsequently necrosis or infarction of the certain parts of the body. So actually the sickle cell anemia or glucose 6-phosphate deficiency anemia, actually this may lead to risky, because this will lead to the increase in the viscosity of the blood and decrease in the blood flow and occlusion of the blood vessels. So what are the symptoms of the anemia or the clinical manifestation of it? Actually, it involves many organs of the body. For example, yellowing of the sclera, as in case of jaundice we can see, and also in case of anemia, yellowing. Also, could be chest pain or angina or heart attack, because as I mentioned before, it will lead to occlusion of the blood vessel, so this will lead to chest pain. Enlargement of the spleen, what we call splenomegaly, yellowing of the skin, because as I mentioned before, in the RBC there is hemoglobin, and hemoglobin is responsible for the redness of the blood. So since there is decrease in the RBC, that means there is decrease in the hemoglobin and yellowing of the skin. Fainting and fatigue, and also could be shortness of breath, could be weakness, muscle weakness also, and also could be changing in the color of stool. The oral manifestation of anemia could be seen in the tongue, here as we can see, atrophic glossitis. Atrophic means depapillation, because there is different type, circumvolute papillae and so on. So there is depapillation and what we call atrophic glossitis. Also, this atrophic glossitis or depapillation may lead to burning sensation of the tongue. Could be angular chylitis, which is usually lesion situated in the angle of the mouth, or could be recurrent aphthous ulcer, ulceration usually involving the oral mucosa in the lip or in the lining mucosa, and actually this will lead to also burning or pain during mastication or during speaking and so on. Actually, there is certain types, for example, in case of sickle cell anemia, this may involve bone changes. So there is also changes within the bone trabeculae, and also the lamina dura becomes more dense, as in case of sickle cell anemia, and also there is delayed in teeth eruption. So could be within the soft tissue, or could be, the manifestation of sickle cell anemia could be within the soft tissue, could be within the hard tissue, delayed eruption of the tooth, changes of the bone trabeculae, and also there is dense lamina dura. The laboratory investigation of anemia could be through the RBC count, the number of the red blood cells, could be by measuring the concentration of hemoglobin, because hemoglobin within the RBC, could be hematocrit value. Actually, hematocrit value means the ratio of the volume of the RBC to the volume of the whole blood components. The ratio of the volume of the RBC to the volume of the whole blood components. Actually, this could be percent, could be expressed by percent. For example, 40% means that the volume of there are 40 milliliters of RBC to 100 of the milliliters of the whole blood component. Mean carboxylar volume, this is representing the volume of the RBC, or the size of the RBC, the red blood cells. Actually, from the mean carboxylar volume, we can know the type of anemia, because actually there is also aplastic anemia and so on. Medical treatment, actually, this is the responsibility of the physician, and also, for example, in case of, iron deficiency anemia, or in case of pernicious anemia, we can give the patient vitamin B12 or folic acid, but actually this is the responsibility of the physician. Now, dental management of patient with sickle cell anemia. This sickle cell anemia, as I mentioned before, because it has many oral manifestations, and actually it is more risky. By the way, the sickling or the sickle cell may occur, or there are two types of sickle cell of the RBC. Could be trait